Hi, I'm Emily Littlejohn, co-director of the Cleveland Clinic Lupus Clinic. I wanted to share with you an interesting new onset lupus case that we have seen here in our clinic. This case illustrates the many phases of lupus with varying physical exam findings, patient symptoms, and organ involvement. It is my hope this will bring awareness to the broad spectrum of clinical presentations that can be caused by underlying lupus. This patient is a 38-year-old female who sustained a cardiac event, found to have a left anterior descending coronary artery thrombosis, requiring thrombectomy. She underwent stent placement and an eventual CABG. An echocardiogram revealed mitral valve regurgitation and a mitral valve vegetation. She then underwent mitral valve replacement with left ventricular mass removal. Her pathology specimens were consistent with Libman-Sacks endocarditis. Seen here is what is typical of Libman-Sacks or morantic endocarditis. You can see small to medium-sized vegetations found on the line of closure in the chordae tendineae of the valves. Libman-Sacks vegetations are the only ones to be found on both the upper and lower sides of the valve surface. Shortly after surgery, antiphospholipid antibodies were found to be elevated, at which time she was referred to our clinic. On review of her history, she endorsed a history of Raynaud's phenomenon and migratory arthralgia. Her blood work showed an ANA titer of 1 to 320, elevated double-stranded DNA antibodies, and lymphopenia. Her creatinine was elevated and she underwent a renal biopsy which showed class 2 lupus nephritis with evidence of thrombotic microangiopathy. She was started on hydroxychloroquine, mycophenolate mofetil, in addition to warfarin for antiphospholipid antibody syndrome. She's been doing well without any progression of her disease. As you can see from this case, lupus can present in a myriad of ways. As rheumatologists, we need to have a keen eye to the many clinical presentations that may be atypical manifestations of systemic lupus erythematosus.